It was amazing. After the webinar, we got calls, we got questions from people asking what they can do to be able to, solve this hormonal imbalance called PCOS. Thank you so much for joining the session today, and thank you to my guest speaker, Dr. Bilqis Williams, who, out of our busy schedule, was able to come online to this IG Live today. Thank you once again, Dr. Bilqis. So I'm going to go through Dr. Bilqis' bio. Dr. Bilqis Williams, as she's a medical doctor, she is a global environmental public health practitioner. Dr. Bilqis Williams possesses over a decade of experience serving in the clinical, research, and managerial and crisis resolution roles. Dr. Bilqis Williams is the creator of the 25% equity rule and has informed diversity and sensitivity policies for Congress candidates in the United States of America. Previously, she has served as the mission ambassador to the Federal Republic of Nigeria for the Federation of International Gender and Human Rights. Dr. Bilqis Williams, she is the first ever recipient of the Peace Prize for Community Activism. She's listed by the Boston University School of Public Health as one of the 20 change makers of our century. Dr. Bilqis Williams came today with decades of experience to share with us today. Dr. Bilqis Williams currently serves as the director on the Canadian Public Health Association Board, Dean of Public Health Advisory of Arbor Heritage University, and chair and chair of the Ontario Strategy for Patent-Oriented Research, Patent Partner Working Group, Canada. Please join me again to welcome Dr. Bilqis Williams.
Thank you so much for having me. And my little sidekick, who will now be joining us, if you all don't mind. This is what happens when you work on the weekend. So thank you so much for that kind introduction here today. And thank you all for attending with us. And also thank you for your patience. So yesterday we can run into the meat of the matter right now, whenever you're ready.
All right. Thank you so much, Dr. Bilqis. So for today's webinar, for the November session of the Protect Mom and Child webinar, EduMumCare, today we will be diving into what we call management of perimenopausal and menopausal symptoms. We all know that menopause is like a time bomb for many women once they get to the stage of menopause. And to be sincere with you, in developing countries, for example, taking an example of Nigeria as the developing country, we have a lot of women that are currently passing through menopause, and they do not have what to do. They don't know the next step to take. I have heard many women talk about not being able to sleep, gaining weight. In fact, it has become so much that many women have died because they do not know how to manage that critical stage in the life of a woman. Diving into this, Dr. Bilqis Williams, the very first question I want you to just kind of look into right now is that when is a woman said to be in the perimenopausal stage? Hi, Dr. Bilqis. Please, if you're able to hear me, please wave. Can you wave your hand? I need one or two persons to wave their hands so I can know that you can hear me. Hi, Dr. Bilqis. Thank you. Thank you so much for the responses. I think Dr. Bilqis Williams is kind of having a little bit of issue. You know, she has a baby with her tonight. This is a weekend for Dr. Bilqis, and I really appreciate her making out time to come for this webinar today. Please, just few seconds for her to sort out that. Thank you so much. I really appreciate. Welcome back, Dr. Bilqis.
Thank you for having me back. Anyway, so perimenopause, it means around menopause. So anytime we refer to something as peri in medicine, it means something around. So you would usually hear it like the perineum. So that means around your vulva or around your vaginal area. So perimenopause means something around menopause or a time around menopause. And it refers to the time during which your body slowly transitions, makes a natural transition to menopause, and it usually ends the end of one's reproductive years. Perimenopause can also be called like menopausal transition. It's literally the translation or the definition of the word. I'm getting some feedback, but I just want to be sure that everyone is hearing me. So if you can hear me on your end, just give me a thumbs up, and I'll just continue as usual.
Yes,
Fantastic. Thank
can hear
you.
you.
So
Yeah.
yes, women start menopause at different ages, um, and you may begin to notice signs of progression towards menopause at a varying age. So, and these factors are determined by several things. So it can be because, you know, in your family, you have a family history of early onset of menopause. You may have undergone cancer treatment. You may have had a hysterectomy in the past. If you are also a smoker, it can impact the onset and intensity of menopause. So that would then cause the perimenopausal time, or how do I put it? Yeah, time or time frame to be different for different people. So that's it. I don't know. Maybe I should expound that more. I'll expound. So around the perimenopausal time, the level of estrogen, which is the main female hormone in your body, rises or falls unevenly. It causes your menses to be altered. And when I mean
Yeah.
altered menses, it means that it can either be lengthier or shorter. So most people associate the beginning of menopause with shorter menses or absence of menses. So they'll be like, oh, my menses used to be 7 days, now it's 3 days. It doesn't necessarily have to be so. Around the beginning of your menopause as well, you may experience a lengthier menstrual period. So that can happen. also you can have like menstrual irregularity, so you can come this month, it may not come in another 3 months, or you may have two menstrual cycles or menstrual flows or menstrual periods in one month. And this is something that you can notice. It can be from your mid-30s to your 40s. So again, depending on all those factors that I listed before: family history, smoking, cancer treatment, hysterectomy, blah blah blah. And then, so because the level of estrogen in your body is fluctuating continuously, it will then cause that alteration in your menses that we've explained. It can be longer, it can be shorter. So you will definitely also not be ovulating. So it will cause an ovulation. So you are having the menstrual flows, but there's no eggs being released. So it may just be that, because you've had that level of estrogen in your body for a long time. It's like when you use a drug, you can have a withdrawal bleed. So when you have a reduction in estrogen as well, you may have. Mommy, the battery's Please excuse me. The battery's I'll plug it for you and then you can watch it. 1 minute, please. Forgive me. So I'm back. Uh, So I'm back now. Thank you. So the because you've had that estrogen in your body for a long time, when it begins to reduce, it's just like when you're using contraceptives. You may start feeling, you may still have withdrawal bleeds that you will mistake for menstrual periods, right? But the only thing you may notice is that your period is irregular because it probably didn't come at the time that it would usually come. So for people who have regular menstrual cycles, they would notice that, oh, this didn't come at the right time, but I'm still seeing like blood, and it may be the regular length and the regular volume of blood that you find, but you may also experience hot flashes, sleep problems. So what most people at this point, I just got like a light bulb moment. What most people refer to as menopause is actually perimenopausal symptoms. So when you start having those hot flashes, sleep problems, mood changes, it's because you are entering into menopause. When you come into menopause, all those changes will have perfected in your body. So if it's like you are going to have sleep problems, you would have become a mainstay in your routine at this point. You would already get used to it. If it's hot flashes, it may have dwindled. You may have stopped having those hot flashes and stuff. So most things that people term as menopausal symptoms are actually perimenopausal symptoms. So sleep problems, so you may have difficulty falling asleep or difficulty staying asleep, or you may even have difficulty sleeping. So you may be having nightmares or nightmarish I don't know, symptoms or conditions or dreams, and then you may have night sweats as well. So I know that for some people, night sweats is a sign of tuberculosis. So you may think that you have tuberculosis and all of that, which is why it's very important. Which is why it's very important for you to know, like, what your normal health status is. Not that there's an abnormal health status. What I mean is normal for you. So if you're hypertensive, you know that your blood pressure is at a level that it should be, that is normal for you, and all of those things, so that if there's a change, you can quickly identify it and isolate that change or the cause of that change. So you may have mood changes. So you know all those mood swings you have when you're about to have your menses, like the perimenstrual syndrome. And people be like, oh my God, I'm just not in the mood. They may become emphasized in the perimenopausal time. You may become a totally different person. So if you used to be bubbly, the life of the party, you may not be the same thing when you become perimenopausal. So these are things that you should start identifying, and be gentle with yourself, be patient with yourself, so that when you start noticing these changes, you should also build a support system, and women should support women. So women supporting women, and yeah, it's not by mouth. You should do it when you start noticing changes in an individual. Some people don't even notice these changes in them. It is somebody else that calls their attention to it and says, something's wrong. I noticed that you've changed, blah, blah, blah. And then, you're always sweating a lot. Are you sure everything's okay? And they may just think it's a hot girl summer, but you are noticing that your friend who doesn't sweat, who is the queen bee of you all, is now sweating profusely all the time. So you may also have vaginal and bladder problems. So vaginal problems, I'll start with dry vagina, so dryness in the vagina or vaginal atrophy. So you may start noticing that, let's say, you'd wear your, what do you call it, panty liner, and you should have some discharge, normal discharge, non-colored discharge, non foul smelly discharge. Let me just push through that there. So you may start noticing that there's no discharge at all in this panty liner, or you just start feeling very uncomfortable, like your labia is getting stuck to your pant. Things that didn't used to happen before. But for people who are sexually active, what they will usually notice is that they're having dyspareunia. So dyspareunia is pain during intercourse. So that's usually the how do I put it, the trigger for most people who are sexually active. Because let's say, vaginal dryness, if you don't use a panty liner, you may not notice it. If you wear cotton pants, you may not have that labia sticking to, your panties issue. Or if you are someone who lubricates, like you use lotion, you moisturize everywhere, you may not notice it. So these are some of the things that you may notice. Bladder problems, so urinary incontinence. So incontinence is that you just pee do, and then when you go again, you just notice that there may be some pee in your panty liner, or there may be some pee in your panties, and you're like, I don't remember peeing or feeling pressed, but you start feeling it or you start smelling it. So for some people, they don't even notice that they are wet. It's just the smell. They're just like, I can smell something, and something is off. Or people start telling you that, something is smelling. Are you sure? Is everything okay? Are you on your period? Did you? And then you didn't notice. And when you go to the bathroom, you notice that as well. Or sometimes it's at night. So some people fear that it is enuresis. So enuresis is bedwetting, what people call bedwetting. So they wake up and they be like, hey, may we never regress, and then like, why am I bedwetting at my old age and blah. But that's not the cause. It's just that you're beginning to have bladder problems around around the perimenopausal time. So for some people, is that you feel pressed all of a sudden. You know how when you have to wee, or when you have to go to the washroom. Sorry, I'm using child language. When you have to go to the bathroom, you can tell from about 15 minutes, 30 minutes that I'm going to need to use the washroom, or you are going to a party and be like, let me just pee before I go, because I know I'll have to pee in a few minutes. But all of a sudden, it's not the one that you are coming from work and you get pressed when you're about to enter that one that happens, I think it's usual in most women. But this is just, you can't regulate your urine. You don't know when it's coming. It just comes to you all of a sudden and you have to go. If you don't go, you will pee on your body. That's the difference. The difference between what you can do now is that I can hold it and open the door and still wash my hands in the kitchen and still quickly microwave rice while I'm going to the bathroom. But that's not going to happen when you become perimenopausal. There will also be decreasing fertility. So if you were trying to have a child, let's say you've gone to the doctor for IVF and they were like, oh, you have 60 eggs that we can fertilize for the IVF. That's going to drop drastically. It might drop to about 20 eggs. So usually we notice about a 40 reduction in fertility. So changes in sexual function as well. So for some people it becomes heightened. For some people it becomes decreased. So you may also have loss of bone density. So this is one that I think concerns us the most as medical doctors. But in recent times, as a public health practitioner, we are continuing to advocate for prescription of drugs and maintenance of symptoms of perimenopausal symptoms for women, because before it gets to the loss of bone density, there are these other things that they've come to complain about, or they may not complain about: hot flashes, sleep problems, mood changes. But you're seeing a 50-year-old woman and you're asking about a menstrual cycle and she's telling you that there's been changes, or you've been seeing her every year and you've noticed those changes, but you never pay mind to it because you're like, well, she's not telling me anything, she's not complaining. So then it then digresses to loss of bone density. By that time it's too late. So as public health officials, we're saying that quickly catch it, nip it in the bud before it gets to that point. So once you start having the hot flashes, start doing the hormone replacement therapy. So anyway, changing levels of cholesterol. So for some women, they may have. So let me double down on the loss of bone density thing. So most people describe it to you as osteoporosis, right? So you would notice that older women around their 60s, they always fall in the bathroom. So if you know an older woman, most of us have had a mom who has fallen down in the bathroom. So and that bathroom, they've been using it for a long time, and now we're like, oh, it's the tiles in the bathroom, but they've been using that tiles before you were born. So it's not really the tiles, it's the loss of bone density that degenerates to that point that when sometimes you don't even need an accident. You just get up from the bed and you just hear a crack sound and then the bone is broken. That's because there's been slow degrading of that bone over time, and so at some point it just gives way, right? So, and then there's changing cholesterol levels. So maybe someone that used to be leper, you just see that you're gaining weight, and then I'm like, oh, but I'm watching my weight. Oh my God, it must be the fufu that I ate last week at the party. It's not the fufu. It's just the perimenopausal syndrome. And then you may lose weight as well. So you notice that some people, when they are growing older, they become really dry, like their features become haggard and strong.
Yes, they become haggard.
Thank you. So it might also be perimenopause. So it's a two-way street. So you may get a lot of something or you may get less of something. So depending on your genetics or family history or just your person, like you said in the beginning. So da, 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 da. Where was that? So 12 consecutive months without a menstrual period makes you officially reach menopause. So, and then the perimenopausal period is over. So by then, all those vaginal problems, the ones that are going to be permanent will be permanent, because the vaginal dryness is not going to come back. The loss of bone density is not like you just go and buy bone plant in the hospital and then add it in or anything, or like you lost bone, then you're going to grow it over. And that's why you don't notice the symptoms anymore, because it's not a continuous thing. It just happens and then it might continue as well for like bone density. But it's something that, if your body is changing, you notice it. But once your body has evolved, it just becomes like, oh, this is the way I am now. So, well, those are things. But I want to end all of these perimenopausal symptoms with that. Good news, there's treatment for everything that I said. Every single thing has got treatment, both like, I don't know, non-medical treatment or non-medicinal treatment and medicinal
Yes.
treatment. So you can use
Yes.
adjunct therapies, you can use medical therapy, depending on your comfort level and the extent of your symptoms. So I'll let you ask
Yes, thank
questions.
you so much, Dr. Bilqis. Look, everything you have said now, I can say that more than 60% of women that have reached out to me on all of the symptoms you have said now do not even know that they are gradually moving towards menopause. And I think that we need to double our effort to continue to pass this information to the public, especially to women, because women's reproductive system, women's body system is dynamic. It's amazing on another level. So women's body system requires lots and lots and lots of, women require lots of information to be able to navigate through life. Thank you so much, Dr. Bilqis. Before we move on, I want to say welcome to everybody just joining the webinar today. On the conversation seat, we have Dr. Bilqis Williams. She is the Dean, Public Health Advisory, Albert Heritage University, New York. So glad to have her on today's webinar for the November edition of Protect Mom and Child. And what we have been discussing today is management of perimenopause and menopause symptoms in women of reproductive age. Moving on, Dr. Bilqis Williams, I will quickly dive into this question that I want to ask you. At what age does women enter the perimenopause and the menopause stage? So sorry, Dr. Bilqis Williams has a baby girl with her today. Oh, okay.
Thank you.
I know. She has a baby girl with her today, and children can be a handful. Thank you so much, Dr. Bilqis Williams.
Thank
And
you.
thank you
And
to all of the audience on the webinar
thank
today.
you for all for being patient. And if my eye suddenly becomes too strong, I'm not perimenopausal. I'm just falling ill. So you might notice me touching my left eye a lot as well. So it's hurting. Anyway, so natural menopause typically occurs around the ages of 45 and 55, and it's part of natural aging process in women. So usually when you tell women, or in my experience, that, oh, you're approaching menopause, they're like, God forbid. It's nothing to be forbidden. It's something that you should accommodate and welcome into your life as usual. It's just another phase. Actually, most women, when they're entering menopause, they are at the peak of their careers. That's when they are transitioning into like executive roles and everything. So it's nothing to be ashamed about. It's something that you should um, embrace, because now it gives you more time to be able to apply yourself to the things that you love, because we all know as women that menstruation and the whole menstrual cycle, the whole month, is a big deal. Having to navigate your life around your menstrual period, your first days, your third days, your heaviest days, your perimenopause, your perimenstrual symptoms, they're a huge deal. So this just opens up a lot more time for you to be able to extend and involve yourself in many more things. I can see somebody
All
on
right.
the video, but I promise you that's not me. So
Oh, okay.
well, I don't know if it is. Please, let's go ahead. I don't think.
All right. Thank you so much, Dr. Bilqis. Thank you so much, Dr. Bilqis. So you had mentioned that from the age of 45 to 55 is when the stage when women start getting into the perimenopause and menopause stage. And I also want to ask that what are the hormonal changes that occur when women enter the perimenopause and menopause stage?
So
Just briefly, I know when you started, you had mentioned some symptoms, but for clarity's sake and for people that are just joining, please, just the hormonal symptoms that occur when women enter the perimenopause and menopausal stage.
So it's estrogen is the hormone that becomes reduced when you enter the perimenopausal stage or the menopausal, and then the menopausal stage. So for estrogen controls a lot of things in our body. It controls your menstrual cycle, controls your ovulation, controls your attitude sometimes. So it depends again, and that's why it fluctuates between um, amongst or between different people. So for some people, even though their estrogen is lowering because they had an initially high level of estrogen, they can still maintain like their usual self. So they don't have symptoms. for some people, they had a lower level of estrogen, so their symptoms, so their estrogen tanks easily, so their symptoms are higher. So those are the ones that get the hot flashes, the sleep problems, the mood changes, vaginal dryness, most especially, the decreasing fertility, most especially, the loss of bone density. So all the things that estrogen controls. So did everyone get that? Hot flashes, sleep problems, mood changes, vaginal dryness, loss of sexual function, and bone density, and again the cholesterol levels, so the weight gain or weight loss thing. That's it.
Thank you so much, Dr. Bilqis. Moving forward, I just want to run through some of the questions that I have with you, and then we go into the questions and answer period, because some questions are already dropping in and want answers too. But before we move on, Dr. Bilqis Williams, what are the risk factors that can put women quickly or early into the perimenopause and menopause stage? Are there risk factors? Are there some things that women do that could quickly push them into the perimenopause and menopause stage?
Okay, so there are some things that I didn't mention as part of the symptoms of the estrogen loss. That's because it's not common in everyone, and that's what these factors that I'm about to mention will predispose you to. So symptoms such as
Okay.
uterine bleeding, or
Okay.
vaginal atrophy or vulvar atrophy. So that vulvar atrophy means that, so if you look at a vulva now, it looks like fleshy, round, like a snail that's fat
Okay.
and well fed. But at some,
Okay.
if you are this group of people that we're about to mention, it will look withered, like a leaf that has gone out of season, like a leaf in fall, something like that. It will start squeezing, it will look wrinkled. It may even cause you pain,
Wow.
like when you sit on it. So stuff like that. And you may notice abnormal uterine bleeding, so you may start noticing lumps of blood. So if you didn't used to have clots in your menses, you may start having it now, and you're just like, oh, when I was even younger, I never had clots. Why am I having clots now? So those are some of the things. And again, this can happen in any other person for other reasons. So this is why I said that you always have to keep abreast of your normal health state as a woman, so that you
Okay.
know when something is out of the ordinary.
Out of
So
place.
smoking is the number one problem,
Okay.
and I find it very fascinating now that most girls are smoking shisha, and they're like, no, it's not smoking, it's just when I was in medical school, we would say that it was what do you call it? What do you call it? Like when you go to party, social smoking or something like that. I forget what, there's a term for it. Recreational smoking.
Recreational
So
smoking.
thank you. So it's something that we've always known. It still predisposes you to it. If you like, go to shisha lounges twice in a week. You are smoking, because for different people, your body holds on to these elements longer than others. So some people will smoke this shisha, and I don't know what is in their body. Their lungs will excrete the CO2 faster. For some of you, your body eats like they are eating a bar. So the CO2 is down there, like they cemented it to your cells, and it will just go around and cause a lot of damage. So don't do what everyone is doing. So whether it's, you know, continuous smoking, like you are a daily smoker, you smoke like 3 bags or I don't know, 3 packets of cigarettes every day, or you are just a one time in a lounge per week shisha smoker, don't do it. It's not worth the hassle. It can also predispose you to cancer, whatever. And also, it just makes the lives of doctors more difficult, because when they are doing
More
hormone
difficult.
replacement therapy for you, it's not going to work as well, or sometimes it doesn't even work because you're countering the effects with smoking and all of that. So really, it's a waste of time. Don't do it. Drinking, I think these two things are just I don't even need to discuss the points. It's like a debate that has already been won several times and over. You know how before they used to say, oh, a glass a day will make your heart healthy. The people that were perpetrating that lie or myth have come out to say that it's a lie. Don't do it. Don't drink. It don't. No cup a day. Nothing. No glass of wine a day helps you sleep. Nothing. It's of no use to you in any way. And we've been saying this for several years, but for some reason, corporate the corporate industries wanted to perpetrate that thing. So whatever. Anyway, don't do it. Don't smoke and don't drink. In indiscriminate use of contraceptives. So we know about family planning, and that's why when you want to do family planning, it's usually in a hospital or a clinic that's designated particularly for family planning. It's not usually a chemist. So when you want to use your contraceptives, don't go to a roadside person. Don't go to Yalago and then so for people who don't speak Yoruba, that's a concussionist, someone like a herbal traditionalist that makes
Herbal
concussion.
mixtures.
Exactly. So don't go there and say, oh, this one is going to cause you not to get pregnant, or don't take Schweppes and alum for after intercourse and say that. No, don't change your face. People have their reasons. So we are not judging anybody here.
Yeah.
So don't do that. If you need help and if you need what do you call it, the morning after pill or an emergency pill, go to an actual clinic and ask for help, or go to a doctor and say that this is what I need this for and I need your help, because some of these things have hormone regulation
Regulation.
systems or contents or condiments or ingredients that may alter